On any given day, 350 million people suffer from a mood disorder. In the United States alone, the economic cost of depression has climbed to $210 billion every year. Most patients are told their suffering is a chemical imbalance. The prevailing cultural consensus treats depression as a spontaneous genetic glitch, occurring entirely inside the brain. Every year, the National Institutes of Health invests $400 million into depression research, funding a decades-long hunt for these biological root causes. Massive genome sequencing studies analyzed over 1.2 million genetic locations to find the hardware malfunction responsible. But they failed to find a single reliable predictive gene for depression. The thousands of genetic variations that influence mood only explain a tiny fraction of the risk. If decades of research and billions of dollars cannot locate a single hardware glitch, we are looking at the wrong half of the equation. This blind spot is the result of a medical error called VSAD, viewing symptoms as disease. In the rest of medicine, treating symptoms without a cause is a last resort. To treat depression without looking at a person's life is like a doctor trying to cure a chronic cough without checking if the patient's house is on fire. Modern psychiatry is trapped in the fundamental attribution error. We obsess over the internal traits of the individual while ignoring the external environment. To understand behavior, we have to look at Kurt Lewin's formula. Behavior is a function of the person and the environment. Psychiatry has spent half a century ignoring the E. By ignoring the environment, we lose the ability to distinguish between a broken brain and a healthy brain reacting perfectly to a broken life. Just as physical pain protects the body by forcing you to rest a broken leg, psychic pain protects your time and energy. Low mood evolved to force our ancestors to disengage from unreachable goals or unyielding environments. It's a biological mechanism designed to conserve resources. This is a cybernetic control system, a moodostat. Like a thermostat, it monitors external conditions and adjusts your internal state. Your mood drops to conserve effort when facing insurmountable obstacles. Once the goal is abandoned, the moodostat resets to a neutral baseline. In this framework, ordinary sadness is not a disease. It is an evolutionary warning system working exactly as designed. Like any mechanical system, the brain's moodostat can genuinely break, resulting in severe organic disorders. Bipolar disorder is a failure of this system. It acts as a bistable system that switches fast between two extremes, never stopping in the middle, fueled by a runaway positive feedback loop. However, for the majority of people, the moodostat is healthy. The problem is that modern life acts as a hostile, relentless trigger. We are caught in modern social traps, inescapable student debt or dead-end jobs, that constantly trigger the mind's give up signal, even though we cannot physically walk away from them. Modern media exacerbates this by fueling biologically impossible ambitions and desires for status that our ancestors never had to satisfy. For many, clinical depression isn't a broken control system. It is a perfectly functioning system being overwhelmed by a modern environment it cannot escape. We must redefine the line between a normal emotional response and a true pathology. Sadness is to depression what normal growth is to cancer. One is a regulated, useful process. The other is that same process running completely out of control. This evolutionary understanding changes how we view the actual role of psychiatric medication. Antidepressants are psychic analgesics. They disrupt a normal response system, functioning for the mind exactly as aspirin or morphine function for physical pain. Aspirin doesn't fix a broken bone. Numbing the psychic pain allows a person to function, but it does not solve the underlying life trap that is causing the alarm to ring. True therapy focuses on investigating the specific, often unsolvable problems in a patient's actual life. Severe depression is a sinking bog. You stand on a tuft of grass, fearful of stepping into the muck, even as your ground disappears. There is dignity in understanding your pain as a logical response to a terrible circumstance, rather than the byproduct of a broken brain. Recovery is the grueling process of making massive life changes, abandoning unreachable goals, and slowly finding your way to higher ground. Resolving the modern mental health crisis requires us to address the reality of the environment that the human mind is trapped in.